AMPATH is the name we use, and it's made up of really a variety of partners. The key partners are a consortium of North American universities led by Indiana University. And then that consortium partners with two Kenyan institutions here, Moi University School of Medicine and Moi Teaching Referral Hospital. They both sit side by side here in Eldoret. So the three of us together, the North American Consortium, Moi University, and Referral Hospital together make up AMPATH. What those three do together is something kind of unusual. And that's to go knock on the door of the Ministry of Health and say, we would like for your problems to be our problems. And so by linking with the Ministry of Health, our clinical agenda is the agenda of the government of Kenya and the Ministry of Health. The Mother-Baby Hospital is really one of the finest places for maternal child care, particularly for pregnant women to come. It's the only time we've had intensive care capability for sick children. So it's a wonderful addition, and it's in the right spot to back up an enormous maternal child health program across Western Kenya. The Mother-Baby Hospital is the best we can offer in support of that effort.
It was our idea, I think, Pam and myself thought of this after our first experience here in Kenya in 1994, wanting to create something that would be more advanced, more suitable, more beautiful for women to deliver, and for doctors here in Kenya to have as their home base. Currently delivers over 8,000 babies a year, 25 babies a day with about 7 cesarean sections a day on average, and has about 70 babies in the newborn intensive care unit on average each day.
I worked with Mother-Baby Hospital from the time that it was opened, because before it was built, I was already in the Department of Pediatrics as a pediatrician, at the same time a lecturer. And so I was the team that actually moved in 2009 when it was opened. So it's been 4 years now. The biggest impact, I would say, it is the kind of service that we have been able to provide for mothers and babies in a spacious environment with equipment that is much better than what we had before. We were in a very small space taking care of babies. One room that was measuring, say, 20 by 20 feet. And we were having an average of 20 to 25 newborns in one go. And we did not have incubators. We didn't have specialized ways of taking children at different stages of gestation. So you'd find that particular one room being warmed up to, say, 30 degrees to take care of the really preterm one. But the term baby, in the meantime, is very uncomfortable. The staff were very uncomfortable. And so having come from that much space, that little equipment to what we have now, I would say is a big blessing.
I think many of us have the perception that living in an underdeveloped or less developed or less resourced area of the world, that the people are less resourced inherently. And that is certainly not the case. There are many of the Kenyan nurses and physicians here who are probably much more capable and much brighter than myself or one of our nurses, and just don't have the wherewithal to do what they know they would be able to do. And so given some support, some maybe organizational capacity, some advocacy in their administrative structures, so they are able to really create the best of worlds for their peers, their human family here. To me, the Mother-Baby Hospital has raised the importance in Kenyan life of women and newborn infants, the most vulnerable. So to me, that's been the most important, is to see a beautiful facility where women who have nothing material can come and have a safe and beautiful, really, experience in delivering their baby into this world. there are so many stories, and the relationships we have with so many Kenyans that in every different part of life enrich us all. But one in particular was shortly after the hospital opened. A student, a medical student, had just rotated at IU and was in Riley Children's Hospital with us and lived with us for about 4 months. There were 3 students there. I tried to convince one, Bet is his name, to go into pediatrics, but he wanted to stay in obstetrics. He returned that year to Kenya, and because they didn't have an obstetric residency yet, he was a clinical officer, so he actually worked in obstetrics, but more as a day-to-day physician assistant. And he ended up at the mother-baby hospital working in obstetrics. Well, his wife was pregnant and was going to deliver at a private hospital here in Eldoret, Kenya, but went into preterm labor. And right then, Beth said, no, we are not going to deliver in the private hospital. We're going to go into the new mother-baby hospital. She delivered at 30 weeks gestation, 10 weeks premature, a little boy. He was in our newborn intensive care unit for a month and a half, is now 3.5 years old, and is a thriving, healthy little boy. He was born on Christmas Eve, and his name is Christian. And we just met Bet walking in the halls of Mother Baby Hospital yesterday and reconnected in a pretty joyful experience. He now has a little girl who's healthy as well. It's so uplifting, I know, to Pam and myself to meet these people and to see over the years now, it's been over 20 years, almost 20 years, to see the journeys and to see how the next generation now are carrying on and how our young people are becoming engaged in friendships. So it's you watch careers evolve, the state of the art of technology now here advancing so much. And people here understanding also their capacity, that they, even though they may be born with nothing, they are given new opportunity now. It's not the material, it's the opportunity to learn, to go to school, to have long-term friendships that are meaningful, and to not only change their lives, but they see that our lives are changed in such an effective, positive way as well.